preemptive stent never reduces mortality. Our number one priority is to invest in health businesses. And the hard part was not selling the company, but dealing with the politics inside of Milliman to sell the company.
Hey, welcome to another episode of the Growth and Scaling Podcast. Today, we are going to jump into some fun topics, and I'm going to feed right into it right now because our guest today, Jon Shreve, is in the medical industry, and he is insurance, medical, all the fun stuff that we all need, don't always like to be involved with, but Jon does. So Jon, jump in and tell us who you are and what do you do?
All right. So I'm Jon Shreve. I'm actually an actuary by training.
Awesome.
But I'm the president of MCG Health.
Okay.
And MCG Health is a company that produces medical guidelines about what's the most appropriate thing to do in various situations. We have a staff of doctors and nurses who read all the medical evidence and interpret it and report back. And these guidelines are used by more than half of the payers in the country and almost half of the hospitals in the country.
Wow.
To help them have conversations about what's appropriate care in various situations. And that's sort of our roots. And then from there, we've turned into a medical technology company where we have software, and now we're automating the authorization process, which involves connections between all these parties, as well as looking at the electronic medical record and figuring out what we can conclude about the guidelines before a person gets involved.
I love it. You unloaded a lot of stuff right there, like a lot of stuff. Tell us about, like, you very subtly said, I'm an actuary. What do you call him?
Actuary, yeah.
All right, by trade. Now, I am vaguely familiar with what that does, but I would say the majority of people in our society have no idea what an actuary is. What is that? Like, what have you been trained in to give you this unique insight into what you do?
Yeah, so my short answer to what an actuary is an actuary is the odds maker for an insurance company.
Love it.
So it's a strong, so I'm a math by background. Actually, my father was a math professor.
Awesome.
And then moved into actuarial consulting. And then actually this business grew up inside of our consulting business before we spun it out.
Awesome. All right. And so your real clients are who? Like, it's not the end user. Who is your actual client?
So at a company level, it's a health insurance company or managed healthcare plan.
Great. Or
a hospital. We have a handful of other ones, but those are the vast majority of our customers. And at those customers, it's usually a medical director or a director of case management or something along those lines.
Gotcha. Awesome. I mean, a lot of people look at healthcare and they don't really look at it from a business perspective. They think it's all about the healthcare, which, I mean, obviously it is at its root.
Yes.
But every one of these organizations you just talked about, they are a business and they need to be profitable, and they don't just depend on the welfare of everyone around them and the government. They are an actual business trying to be efficient and trying to be profitable and trying to make good business decisions. How do you help these companies to be more effective in their business?
Well, we kind of think about it by saying, while a patient is not our customer, we put the patient at the center. So
awesome.
So we write the guideline as in what's the very best for each person. And it's because we do that both sides trust us.
Love it.
So it's so we are saying these are the most.
And both sides meaning who? The hospital and both. The insurance?
Yes. Yep. Yeah. So let's say healthcare providers and healthcare payers.
Love it.
In broad strokes. So
Love it.
So we're we're helping both of them figure out the right thing to be doing, so that in the end financially they get to the right spot as well. And the thing that people people think about, oh, the insurance companies denying care all the time,
right?
There's a flip side to that as well, which is healthcare providers doing things you don't need on a regular basis. And so it's the insurance companies are denying things because they're from their point of view, they're being asked to pay for things that aren't appropriate,
right?
And there's the other side of it as well, so I'm also not defending the insurance companies there. I'm just saying that there's two sides of that coin that people often don't recognize.
They almost never do they? It's
no.
Until you say, why do you need me to go run that test? There may not be any reason for you to go run that test, but they're getting paid for it. So
that's right. Yeah, I actually had a personal experience where one of our editors was talking about how stents, hardly, if you haven't had an event, so sort of a preemptive stent, never reduces mortality.
Right.
And I remember he was like maybe it reduces chest pain, and then 2 years later he came back and said it doesn't reduce chest pain either. And then my father says, and he flies a little Mooney, and so he needed his FAA physical, and he's having his FAA physical, and the doc said, "Oh, I don't like how your heart sounds. Maybe you'll need a stent." I was like, "Stop! Do not do that.
Don't take me out of my Mooney." I love little Moonies; those are fun little planes. Well, so you really are, for all intents and purposes, those listening, he's got a great business helping us, the consumer, when dealing with the game that's being played between insurance and hospitals or healthcare providers. Okay, I love it. Love your business even more now than I did before. So now that we know what you do, tell us about your actual business. I mean, you've been in business since at least 2007 with this structure, right?
Yes. Yeah.
And that's a long time for most people thinking about their own businesses. They're thinking, okay, I started 2 years ago, 5 years ago. That is a great life cycle for business. Tell us about your growth journey and where you're at now versus, are there highlights along the way that you feel like were pivotal moments where you were able to grow the business?
Yeah. So I'll actually go back. 2001 was when, within our consulting firm, Milliman, we have sponsors, which are really owners of practices. And a group of us bought this practice from another set of actuaries at Milliman.
Gotcha.
So I was the chairman of the company from starting 2001. And I became CEO in 2007 when the current management was having trouble putting a budget together. And so I said, I'll step in, but I was doing it on a part-time basis because I was running an actuarial consulting practice and several other things at the same time.
Right.
And so sort of in the late 2000s, I was gradually getting involved in the business. A lot of it was running itself, but I was also getting more involved.
Okay.
So in 2012, we decided to move it outside of Milliman, and we sold it to Hearst Corporation.
Okay.
So we've been with Hearst ever since then.
Awesome.
So for me, it's just been, this is sort of the path, and I just enjoy growing it, and I'm continuing to do so.
I just wanted to take a few seconds to tell you about a program that we have assembled with a lot of our podcast guests and a lot of people who are listening to the show who are feeling the same way that they do. There's a recurring theme. You'll hear a lot of these founders talk about, I couldn't have done it without my team. I couldn't have done it without a support group of peers. I couldn't have done it without having someone to talk to that understood my feeling of isolation as an operator of my business. You see, you're not alone. It is hard running a business, and it's even harder when you know you can't express all your deepest concerns and frustrations with your executive team. It makes them nervous. It gets them scared. You don't want scared people on your executive team. So where do you turn? The Captain's Council is where you turn. The Captain's Council, it is an organization that we are put together with podcast guests, as well as people who are listening who are in the same boat. You see, peers are the only ones that can give you the type of empathy, the type of advice that only a founder or operator know and understand. Go check it out at captainscouncil.com. I know you're going to love what you see there. We have put together an organizational structure that has small group settings, a global community of founders and operators, as well as monthly and quarterly in-person events. You're going to love what you see there. I can't wait for you to check it out and enjoy the rest of this episode. So what does that actually mean? So as you sell the company to Hearst, so backing up a step. So 2001, you were involved with the kind of the core agency or the group that you now call your business, right? I mean,
yes.
And then in 2007, there was some funky stuff going on with leadership and budgets, things like that. You jumped in to kind of say, all right, look, let's just do this the right way. And somewhere along the way, you sold to Hearst Corporation, which is a massive organization, and you're growing within that ecosystem now. Is that right?
That's right.
Awesome. Now, was that a strategic sell into Hearst? Like, what was the value of becoming part of their umbrella of companies?
So it was a combination of things. So one was that the 15 people who bought the business inside of Milliman in 2001, a number were getting ready to retire, and we didn't have a good exit for them.
Makes sense.
I was the last one of the 15 who said, yeah, I agree that we should sell, because I thought I was going to retire at Milliman
right.
as an actuary.
Right.
But we got to that point. But the other side, probably more important for the business, is that running a product company inside a consulting firm wasn't working all that well. So,
right.
They weren't being, purposely, obstructionist or anything, but it was just, I described it as sand in the gears. It's like,
right.
Why aren't you following our policies on this, that, or the other thing? Well, because we're not consulting,
right.
And the policies are written for consulting. And we have these rules and those and so forth. So
right.
When we went to Hearst, then our sister companies had similar profile stuff.
I gotcha.
And we started learning back and forth from them. And actually, I have a graph of revenue that shows I put a little Hearst marker on it, and it was growing, and then it started growing faster after we joined Hearst. So really getting to the right environment where my goals are the same as my boss's goals are. We can just go.
That's really cool. So you feel like becoming, selling the company into a bigger organization was a great move because not only were you better funded, I'm assuming, and some people got their exits, but also because you were able to strategically align with not only the mission vision of the mother company, but also the sister companies who were in relevant playing field as you. Is that right?
Yes, that's right. Yeah. So at this point, we have 4 sister health companies, and we have when we first joined Hearst, we were in a group called Hearst Business Media. And that included some transportation businesses and some financial businesses. They've since split it out because the Hearst board has said our number one priority is to invest in health businesses. So
gotcha.
We're sort of we're going in that direction as we go forward.
Very cool. Very cool. I love this story. This is a fun growth story because I think a lot of people out there, when they think of growing their business, they get so excited about the business. They don't really think about exits or being acquired, or a lot of them fail to think about what happens if we do want to exit some of the partners, or if we do want. I think this is a great, fascinating story. Is there something you feel like you did really right? And then after that, I'm going to ask you, is there something you did really wrong in making that move?
I guess in the end, we had decided that we're leaving Milliman, I think the choice of Hearst was very much right, because we had
Awesome.
in the end like four other offers, um, and when I look at each of the four, and I won't name those, but when I look at each of the four and where we would have ended up subsequently,
Yeah.
uh, there's no way it would work out. The interesting thing is Hearst and Milliman are both private companies, so that when I look at the public ones, that's not the environment I'd want to work in.
Right.
And uh, and they have both companies have strong intellectual leadership.
Cool.
And so sort of that combination of, so we have opinions about the things that we're doing, and and we're out there talking about them, and so in some ways very, very similar. In some ways they couldn't be more different, because Hearst is sitting in a trust fund that was created when William Randolph Hearst died in the 50s, and management's job is to grow the size of the trust fund, essentially.
Love it.
And so that's what they're doing.
That makes sense.
Milliman's more employee owned, and it's for the benefit of the employees.
Right.
So it's two very different things, but
very different model. Yeah, very different model.
Yeah.
So as you,
but similar feel in the end.
Yeah, and as you make that transition, and this doesn't necessarily need to be a point as to something that maybe was done wrong or anything like that, but what has been your biggest challenge in those transitions? I guess I should ask. Has it been difficult, or is it pretty easy?
So I always say the hardest year I ever worked was 2012. And the hard part was not selling the company, but dealing with the politics inside of Milliman to sell the company.
I see. Interesting.
So that was because that's a partnership in effect.
Right.
And so you just have a lot of things to deal with.
Opinions. Yeah.
At Hearst, I would say, so my boss is the president of Hearst Health, and his boss is president of Hearst. And the three of us are very much aligned, and it's very easy to work with them and make the right decisions, so I don't feel like overmanaged or whatever.
Awesome.
But one challenging part is corporate staff sometimes feels like they should tell you what to do, as opposed to being a service organization.
Of course.
And I like to remind them of it. But and it goes both ways. There are times when they need to tell us what to do. But mostly it's how do we align it so that their job should be, how do I help MCG and all the other companies grow as much as possible?
Right.
And so and we have some great corporate support in that regard, like our legal support is just fantastic, for example. But other times they can get too bureaucratic, and so I love it. So that's the one challenge here, but mostly,
and that's where every founder listening to this is thinking, do I want to become part of a bureaucracy?
Yeah, that's right. Well, but that's where my boss and his boss, are so aligned that it's not.
It doesn't feel that way
for the most part a problem, and maybe it's more like the parts of our company that touch the bureaucracy have more. So not me as much as my finance guy and my HR.
That makes sense.
It's just they have to deal with more of it than the rest of us do. So
I love it.
Just a little bit on technology.
What advice do you give a founder who is, or even a founder group like what you were dealing with? What advice do you give to them in terms of making that decision to ultimately be acquired, to continue to operate after the acquisition versus just leaving and exiting? What are some of your thoughts on those couple things?
Yeah. So I've seen, many people who have exited and then, were tied in for 2 years and then left. Right. So,
right.
And if they're, if they have a desire to do something else, that's great.
Right.
So that's a good direction. If on the other hand, it's sort of, you love what you do,
Right.
it's a good chance to continue to grow it and build it up from there. So it's
Right.
so it's an individualized choice of whether you keep going with it or not. I love working with everybody at the company, so it's
Yeah.
when I think of doing something different, it's like, or even retiring, it's like, no, that wouldn't be fun.
That's awesome.
So it's so that's where
That's
that
great.
is.
That's great. Well, I appreciate that, because I think a lot of people do find themselves very, very torn as to what should I do. And to your point, there is a light at the end of the tunnel. You either you can completely just go away from the business, do your own thing, or sticking with it isn't such a negative thing because you have a group supporting you. You have more, to your point, a finance guy, an HR person who's kind of coming in and helping you regularly, bring you up to speed, because likely most companies aren't up to speed as they would be if they were part of a bigger organization.
And it's less of bringing us up to speed. It's more of, we have those people, and they're the boundaries that deal with some of the more bureaucratic side.
Love it. Love it. Now, I always ask founders this, and operators of businesses, who is it that is in your circle who is kind of that mentor or pillar that you kind of go to, keeps you motivated, keeps you inspired to build and grow your business?
It's at the core, the people that I work with most are the ones on my team.
Awesome.
And they, and in the end, actually, as a leader, I feel my most important job is to make them make decisions.
Right.
So I'm relying upon them to help us figure out where we're going.
Right.
And I have one woman, Linda Michelow, who joined the company 2004, 2005, and has been with us ever since. And
awesome.
She just drives I'd say she drives the culture of the company in a fantastic way.
I love it.
So
everybody needs that person, don't
my
they?
right hand along. That's right. Yep.
Love it. Love it. I love shout outs like that too. Good call. Well, listen, how do people follow you if they're interested in what you're up to? Are you around on LinkedIn or other places on social media?
Yeah, so I do some fairly regular postings on LinkedIn.
Awesome.
So that's the best place to find me.
Okay. Well, we'll put links to you in the show notes and to your business and everything you got going on. So I appreciate you so much for being here today. Thanks for sharing your insights with us.
My pleasure.
Hey, I hope that interview was good for you. I absolutely loved it. What a fun story. I mean, you don't hear about people sticking around in one business for this long in general, but when you do, it's fascinating to see the effects of growth before acquisition, growth after acquisition, and all the stuff that happened in the middle. Very fascinating stuff. If you're in a business that is considering growing through acquisition or being or acquiring, listen to this interview. Share it with others that need to hear it. Like, subscribe, and put in the comments below the name of your business. And are you considering acquisition or are you considering acquiring? What are you doing to grow and enhance your business? I want to know. Throw it in the notes. We'll talk to you later, and we hope to see you in our community. Thanks for being involved with the Growth and Scaling podcast, and we will see you on the next episode. Like, share, subscribe, send it to anyone you can. We'll see you later.